Coffee is the favorite drink of millions of people, which gives a boost of energy from the very morning. But did you know that drinking it can be a threat to your health? In this video, we will tell you about 10 serious problems that coffee can cause, from diabetes and gastritis to cirrhosis of the liver and pancreatic cancer. These diseases can develop unnoticed while you continue to enjoy this popular beverage. Be aware that even 1 cup of coffee can affect your health more than you think. Watch to the end to learn how to avoid these risks and keep yourself healthy. This video will be extremely informative and helpful. So, if you want to become a master of your health, click like, and let's get started. Number 10. Gallstone disease and gallbladder disease. Coffee is a beverage that many people are used to consuming every morning to perk themselves up and start the day with energy. However, not everyone knows that caffeine can cause serious health problems, especially when it comes to gallstone disease and gallbladder disease. This issue deserves special attention, as it is directly related to the occurrence of severe complications. Caffeine stimulates the production of bile in the liver and its release into the gallbladder. This process is natural, but it can be fatal for people who suffer from gallstone disease or have a predisposition to gallstones. When the stones begin to move under the influence of increased bile secretion, they can block the bile ducts, leading to inflammation of the gallbladder, acute cholecystitis. This condition causes severe right subcostal pain, fever, and may require immediate surgical attention. According to a study conducted by the Centers for Disease Control and Prevention, CDC, frequent coffee consumption increases the risk of gallstone disease exacerbation in people already suffering from the condition. Regular caffeine consumption of more than 400 milligrams per day, about 4 to 5 cups, was found to increase the risk of surgical procedures such as gallbladder removal, cholecystectomy. Scientists also noted that caffeine stimulates excessive bile secretion, which can provoke an exacerbation of the disease. Research from the Harvard T.H. Chan School of Public Health also confirmed the link between regular coffee consumption and the risk of gallbladder disease. They found that people who consumed more than 3 cups of coffee a day had a 30% greater risk of forming gallstones than those who drank coffee less frequently. An example of a person who has suffered from excessive coffee consumption is Jonathan Smith, 49, from the U.S. For more than a decade, Jonathan started each day with several cups of strong coffee. He didn't even think about the harm his habit could cause. At one point, he began to experience severe pain in his right side. At the hospital, doctors diagnosed him with acute cholecystitis caused by moving gallstones in his gallbladder. He had to undergo an emergency surgery to remove the gallbladder. According to doctors, regular coffee consumption could have significantly aggravated his condition and become a trigger for the exacerbation of the disease. To minimize the risk of gallstone disease and its complications, especially in people prone to such diseases, it is important to review their habits related to coffee consumption. Experts from the National Institutes of Health, NIH, recommend limiting coffee consumption to 1 or 2 cups per day, or avoiding caffeine altogether if you have already been diagnosed with cholelithiasis. Instead of coffee, you can pay attention to herbal teas, which do not have such an aggressive effect on the gallbladder. Green tea, for example, is known for its antioxidant properties and can be a great alternative. You should also maintain a healthy lifestyle. Eat regularly, avoid long breaks between meals, and pay attention to physical activity. This will help maintain normal gallbladder function and reduce the risk of stone formation. Number 9. Irritable bowel syndrome, IBS, and chronic inflammatory bowel disease. The caffeine in coffee irritates the intestinal mucosa, causing it to become inflamed and activating peristalsis, the wave-like contractions of the intestines that propel food through the digestive system. For a healthy person, this may be a barely noticeable effect, but for people with IBS or chronic inflammatory bowel disease, it can exacerbate symptoms: severe abdominal pain, diarrhea, flatulence, and impaired digestion. Research conducted by the Harvard T.H. Chan School of Public Health showed that regular coffee consumption can significantly worsen the condition of patients with chronic inflammatory bowel disease. Researchers have found that patients with IBS who drink coffee daily have a 40% increased risk of exacerbations. This is due to the fact that caffeine increases inflammation and irritation of the mucosa, which worsens intestinal function and contributes to the progression of the disease. According to the National Institutes of Health, NIH, about 10 to 15% of the world's population suffers from irritable bowel syndrome. The condition significantly reduces quality of life, especially in those who regularly consume irritating foods such as coffee. The NIH report notes that caffeine not only speeds up peristalsis, but also triggers the release of the hormone gastrin, which increases stomach acid production and irritates the intestines. When combined with inflammatory conditions such as ulcerative colitis, this can lead to chronic digestive disorders and even dangerous complications such as intestinal perforations. For example, Jennifer Wilson, 35, from Canada, suffered from irritable bowel syndrome for 5 years. Despite her diagnosis, she continued to drink coffee daily, believing it to be the only way to stay awake at work. However, her condition worsened over time. Eventually, she developed chronic diarrhea and severe pain, requiring hospitalization. Doctors noted that regular coffee consumption was the catalyst for the progression of her disease, leading to significant complications. After giving up coffee, her condition improved and her symptoms became less frequent. To reduce the risk of worsening symptoms of IBS and chronic inflammatory bowel disease, it is important to make changes in lifestyle and dietary habits. First of all, it is recommended to limit or completely eliminate coffee from the diet. As an alternative, you can consider beverages such as herbal teas or decaffeinated coffee, which do not have an irritating effect on the intestines. The American Institute for Cancer Research also recommends that you consider enriching your diet with foods that support intestinal health, such as fermented foods, kefir, yogurt, and fiber-rich foods, vegetables, fruits, whole grain products. This helps improve peristalsis, reduce inflammation, and strengthen the gut microbiota, which helps improve overall digestive health. It's important to remember that coffee is not the only source of caffeine. Drinks such as black tea, energy drinks, and chocolate also contain this substance, so it's worth keeping an eye on the amount in your diet. Number 8. Glaucoma and increased intraocular pressure. Glaucoma is one of the most common and dangerous eye diseases in which intraocular pressure increases, causing damage to the optic nerve. This disease can develop subtly, often not showing up in its early stages, but the result can be complete loss of vision. Caffeine, as scientists at the Harvard T.H. Chan School of Public Health, increases intraocular pressure in people with glaucoma or an increased susceptibility to the disease. Pressure levels rise especially after regular coffee consumption, which creates chronic tension in the eye and increases optic nerve damage. Studies conducted by the National Institutes of Health, NIH, have shown that consuming more than 300 milligrams of caffeine per day, equivalent to 3 cups of coffee, can increase intraocular pressure by 2 to 3 millimeters of mercury column in people with glaucoma. While such changes may seem small, in practice it can accelerate the process of optic nerve destruction, leading to gradual vision loss. According to the NIH, as many as 60 million people worldwide suffer from glaucoma, and this number continues to rise. Moreover, about 10% of patients with this diagnosis lose their vision due to late detection of the disease and untimely treatment. Coffee affects the regulation of intraocular pressure by increasing the production of adrenaline and other stress hormones, which contributes to the narrowing of the vessels that supply the eyeball. This leads to insufficient blood supply to the optic nerve and deterioration of its condition. One example is the case of 58-year-old Mark Taylor from the USA, who for many years drank 4 cups of coffee a day, not realizing that he was suffering from glaucoma. He noticed that his vision began to deteriorate, but wrote it off as age-related changes. When the symptoms became more apparent, intermittent eye pain and blurred vision, Mark went to an ophthalmologist. The diagnosis was shocking: progressive glaucoma caused by chronically elevated intraocular pressure, exacerbated by daily coffee consumption. The doctor explained that the constant increase in pressure in the eyes had caused damage to the optic nerve, and unfortunately, some of the vision could no longer be restored. Mark had to give up coffee completely and began intensive treatment to prevent total vision loss. To minimize the risk of glaucoma or prevent its progression, you should be careful about your diet, especially if you have already been diagnosed with elevated intraocular pressure or have a hereditary predisposition. First and foremost, it's important to limit or completely eliminate coffee and other caffeinated beverages such as black tea, energy drinks, and carbonated beverages, which can increase pressure in the eyes. The American Heart Association recommends focusing on foods that promote healthy blood vessels and normalize blood pressure, such as vegetables, fruits, and nuts. Also, regular visits to an ophthalmologist to measure intraocular pressure and monitor optic nerve health can help detect early signs of glaucoma and begin treatment in a timely manner. There are safer alternatives to coffee: herbal teas and decaffeinated beverages. They have no negative effect on intraocular pressure and can help avoid serious glaucoma-related complications. Number 7. Anxiety disorders and chronic migraines. Caffeine found in coffee is a powerful central nervous system stimulant. Its effects on our bodies go beyond simply increasing alertness levels. According to the American Psychological Association, caffeine can increase symptoms of anxiety disorders such as panic attacks and constant feelings of restlessness. At high doses, caffeine promotes the production of stress hormones such as adrenaline and cortisol, which can exacerbate anxiety and trigger panic attacks. In addition, caffeine can be a catalyst for chronic migraines. The Harvard T.H. Chan School of Public Health has revealed that caffeine can alter the tone of blood vessels in the brain. Its stimulation causes temporary vasoconstriction, which can lead to headaches and migraines, especially in people prone to these conditions. Constant coffee consumption can also be addictive, making symptoms even more intense when trying to reduce the dose. According to the Centers for Disease Control and Prevention, CDC, about 15% of adults in the U.S. suffer from anxiety disorders, and about 12% suffer from chronic migraines. That said, studies show that 30% of people with migraines attribute their condition to caffeine consumption. Moreover, Howard Hughes Medical Institute conducted a study that found that people with frequent attacks of anxiety disorders have a hypersensitivity to caffeine, which exacerbates their symptoms and makes treatment less effective. Caffeine, by increasing nervous system activity, can exacerbate symptoms of anxiety disorders such as panic attacks, depression, and cognitive impairment. These conditions not only impair quality of life, but can cause serious psychological and physiological problems that require medical intervention. Take a look at the story of 45-year-old Laura Martin from the UK. Laura was a cheerful woman who liked to start the day with a few cups of strong coffee. She believed it helped her focus and cope with her daily tasks. However, over time, she began to notice constant panic attacks and migraines that were impairing her quality of life. Laura didn't attribute her symptoms to caffeine until she was evaluated by a therapist. The diagnosis was clear. Her anxiety disorders and migraines were directly related to excessive coffee consumption. Unfortunately, her condition required serious treatment and lifestyle changes to deal with the effects of this habit. To minimize the risk of anxiety disorders and chronic migraines, especially if you are prone to these conditions, it is important to closely monitor your caffeine intake. American Heart Association experts recommend limiting coffee consumption to 1 or 2 small cups a day and avoiding caffeine in the afternoon to avoid disrupting sleep patterns. You should also pay attention to foods that contain caffeine, such as black tea and energy drinks. For those who are already struggling with anxiety disorders or migraines, it may be helpful to consult with a doctor to determine how much caffeine is affecting your condition. It's important to look for alternative ways to stay awake, such as exercise, meditation, and a balanced diet that don't negatively impact mental and physical health. Also, don't forget to support mental health through regular counseling with psychologists and psychotherapists who can offer strategies to reduce stress and improve overall well-being. Number 6. Pregnancy and carrying a fetus. Caffeine, although a popular stimulant, has the ability to penetrate the placenta, thereby affecting the developing fetus. According to the American College of Obstetricians and Gynecologists, high levels of caffeine consumption during pregnancy may be associated with an increased risk of miscarriage, preterm labor, and low birth weight. These complications can jeopardize both the mother's health and the baby's life. Caffeine affects fetal development in several ways. First, it can interfere with the normal development of the baby's organs and systems. Studies show that high doses of caffeine may be associated with the risk of birth defects, such as cardiovascular anomalies. Second, caffeine may increase the risk of preterm labor and developmental problems because it stimulates the uterus and can cause contractions. The National Institutes of Health, NIH, notes that drinking large amounts of caffeine, more than 300 milliliters a day, increases the chance of preterm labor by 30%. In a study conducted by the Harvard T.H. Chan School of Public Health, found that women who consumed more than 200 milliliters of coffee per day during pregnancy had a significantly increased risk of miscarriage and premature birth. The results of the study show that caffeine can negatively affect fetal development, leading to an increased likelihood of various complications. Similar conclusions were made by the American Institute for Cancer Research, emphasizing that high caffeine consumption is associated with the risk of more serious complications, such as problems with the development of the central nervous system of the fetus. One example is the story of 34-year-old Emily Johnson from Canada. Emily, expecting her first child, started every morning with a cup of strong coffee. She believed that coffee helped her to stay awake and energetic. However, midway through her pregnancy, Emily began having problems with high blood pressure and ended up suffering a premature delivery at 32 weeks gestation. The baby was born with low birth weight and required additional medical intervention. Her doctor recommended that she reduce her caffeine intake, but by then, there were already serious problems with the baby's development. To minimize the risk of complications during pregnancy, it is important to be mindful of your diet and caffeine intake. The American Heart Association recommends limiting caffeine intake to 200 milliliters per day, which is equivalent to 1 cup of coffee. This will help reduce the risk of miscarriage, premature labor, and fetal developmental problems. Women expecting a baby should also consider other sources of caffeine in their diet, such as tea, chocolate, and some beverages. If you choose to avoid caffeine, alternatives include caffeine-free drinks or herbal teas, which do not contain caffeine and do not pose a risk to pregnancy. Consulting with your doctor is also an important part of preparing for pregnancy. A specialist can help you develop a plan to reduce your caffeine intake and suggest safe alternatives to keep you energized and alert without harming the health of your baby. Number 5. Osteoporosis and increased risk of fractures. Coffee contains caffeine, which, in addition to its stimulating properties, can significantly affect calcium absorption in the body. Calcium is key to maintaining bone strength and preventing osteoporosis, a condition in which bones become brittle and prone to fractures. According to American Bone Health, each additional cup of coffee per day can increase calcium loss through the kidneys by 6 milligrams. Osteoporosis is a condition characterized by a decrease in bone density, making bones brittle and prone to fractures. Older adults, who may already have reduced bone density, are particularly vulnerable to this condition. The National Institutes of Health, NIH, notes that regular coffee consumption can exacerbate this condition, especially in people who already have a calcium deficiency in their diet. A study conducted by the Harvard T.H. Chan School of Public Health found that high coffee consumption may be associated with increased bone mass loss and increased fracture risk in older adults. The study examined more than 5,000 participants over the age of 60 and found that those who consumed more than 400 milliliters of coffee per day were 20% more likely to have bone fractures compared to those who avoided the beverage. These findings are supported by the American Institute for Cancer Research, which emphasizes that caffeine promotes the removal of calcium from the body and can weaken bones. Consider the story of John Smits, a 68-year-old resident of the UK. John, an active coffee drinker, drank 5 cups of coffee every day, believing it helped him stay alert and active. He did not pay attention to the fact that coffee could affect his health. As a result, a few years later, he experienced serious bone problems. One day, just by falling on a slippery surface, John broke his hip. After medical tests, it was found that his osteoporosis was greatly aggravated by his high coffee consumption. To prevent osteoporosis and reduce the risk of fractures, especially if you consume coffee, you should pay attention to the balance in your diet. The American Heart Association recommends compensating for possible calcium losses by increasing your intake of foods rich in this mineral, such as dairy products, leafy green vegetables, and calcium-fortified beverages. If you can't give up coffee completely, try to reduce your coffee intake to a reasonable level of no more than 200 to 300 milliliters per day. In addition, include calcium supplements and vitamin D supplements in your diet to promote better calcium absorption and bone health. Be sure to consult your doctor or nutritionist to determine the optimal amount of coffee and appropriate supplements to maintain a healthy balance and prevent osteoporosis. Number 4. Type 2, diabetes mellitus and impaired insulin sensitivity. Caffeine, the main active ingredient in coffee, can affect many aspects of our health. One of the most serious effects of its consumption is decreased insulin sensitivity. Insulin is a hormone that regulates blood sugar levels, allowing cells to absorb glucose and use it for energy. When insulin sensitivity decreases, cells become less responsive to its effects, leading to higher blood sugar levels and ultimately worsening diabetes control. The American Diabetes Association emphasizes that caffeine can impair the body's ability to use insulin effectively. Studies show that regular coffee consumption can lead to poor glycemic control in people with type 2 diabetes, increasing the risk of developing serious complications such as cardiovascular disease, diabetic nephropathy, kidney disease, diabetic foot, and blindness. A study conducted by the Harvard T.H. Chan School of Public Health found that coffee consumption is associated with higher blood sugar levels in people with type 2 diabetes. The study analyzed more than 4,000 participants, and the results showed that regular coffee consumption was associated with worse blood sugar control. People who consumed more than 4 cups of coffee a day had a 30% higher risk of worsening the condition compared to those who drank coffee less frequently. The Centers for Disease Control and Prevention, CDC, also confirms these findings, noting that caffeine can impair glycemic control and promote insulin resistance. In addition, the American Heart Association singles out caffeine as a factor that contributes to high blood pressure and makes diabetes management more difficult. An example is the story of Claudia Nova, a 52-year-old from Spain. Claudia, suffering from type 2 diabetes, drank coffee in large quantities, believing it to be beneficial for keeping alert and improving concentration. She had neglected to monitor her blood sugar levels and relied on coffee as a means of boosting her vitality. As a result, her regular coffee consumption made her blood sugar levels harder to control, leading to complications such as diabetic nephropathy and the early stages of diabetic foot. To minimize the risk of worsening type 2 diabetes, there are several important aspects to consider. First, Limiting coffee consumption can play a significant role in maintaining your health. Try not to exceed the daily allowance of 200 to 300 milliliters of coffee. If giving up coffee seems difficult for you, try gradually reducing the amount and replacing it with low or no caffeine drinks. It is very important to monitor your blood sugar levels. Regular checks and adjusting your treatment based on test results can help you better control your glucose levels and prevent potential complications. A balanced diet is also crucial. Including low glycemic index foods and high-fiber foods in your diet can help in better blood sugar control and reduce the effects of caffeine on your body. Don't forget to consult your doctor. Talk to him or her about the possible effects of coffee consumption on your health and get recommendations for the optimal amount of coffee in your diet. Following these recommendations will help you reduce your risks and maintain control of type 2 diabetes, which in turn will keep you healthy and vibrant. Number 3. Chronic diseases of the liver and pancreas, cirrhosis, pancreatitis. When coffee is ingested, it stimulates the secretion of gastric and pancreatic juice. Normally, this can be harmless, but for people with chronic liver disease, such as cirrhosis, or pancreatic disease, such as pancreatitis, this process can lead to serious complications. Juice secretion increases the strain on already weakened organs, exacerbating inflammation and damage. This can lead to dangerous conditions such as pancreatic cancer, liver failure, and pancreonecrosis. Scientific research supports this correlation. Specifically, a study conducted by Howard Hughes Medical Institute found that caffeine can increase inflammation and disrupt normal pancreatic function. In this study, researchers found that regular coffee consumption can accelerate the progression of pancreatitis, increasing the risk of developing more severe disease. Consider a case study. 58-year-old Jonathan Smith from the United Kingdom. He suffered from chronic pancreatitis and continued to consume large amounts of coffee, ignoring doctors' recommendations. His coffee addiction aggravated his condition, and he faced serious complications such as pancreonecrosis, which required urgent medical attention. To minimize your risk and protect your organs from possible harm, you should follow a few simple guidelines. First of all, limit your coffee consumption, especially if you have liver or pancreas problems. Gradually reduce the amount of coffee you consume to a safe level, and, if necessary, replace it with caffeine-free beverages. It is also important to monitor your health and get regular medical checkups. This will help detect and control inflammation and other organ problems in a timely manner. In addition, follow a balanced diet rich in antioxidants and anti-inflammatory foods that will help keep your liver and pancreas healthy. Consultation with your doctor is an integral part of prevention and treatment. Talk to a medical professional about the optimal amount of coffee you can consume without harming your health, especially if you have chronic health conditions. Following these guidelines will help keep you healthy and prevent potential complications, giving your body the protection it needs. Number 2. Gastritis, gastric and duodenal ulcers. Coffee stimulates the production of stomach acid, which can be extremely dangerous for people with pre-existing gastrointestinal problems. Increased acidity in the stomach can aggravate inflammation, lead to ulcer formation, and cause serious problems such as ulcer perforation or internal bleeding. Scientific research confirms these dangers. A study conducted by Howard Hughes Medical Institute found that caffeine can significantly increase gastric juice production, which aggravates gastritis and canker sores. This results in an increased risk of worsening inflammation and ulcers. Studies conducted by the Harvard T.H. Chan School of Public Health shows that coffee stimulates gastric acid secretion, which is extremely dangerous for people with inflamed gastric mucosa or an existing ulcer. Exposure to caffeine aggravates inflammation, causes erosions on the walls of the stomach and duodenum, which can lead to the development of ulcers, as well as their perforation, a condition in which a hole is formed in the wall of the organ, causing serious complications. Also, according to the National Institutes of Health, constant consumption of coffee in large quantities is associated with an increased risk of developing gastroesophageal reflux disease, GERD, which is accompanied by chronic heartburn and damage to the esophageal mucosa. Over time, this can lead to precancerous changes in the esophageal tissues, increasing the risk of cancer. A case study shows just how serious the consequences can be. Ana Castillo, a 35-year-old woman from Spain, worked in a stressful environment and started the day with 3 cups of strong coffee. She often ignored the discomfort in her stomach, thinking it was a normal reaction to stress. One day, however, the pain became unbearable, and she was taken to the hospital with a diagnosis of a perforated ulcer. Doctors reported that regular coffee consumption aggravated her gastritis and was a key factor in the development of her peptic ulcer. If you have been diagnosed with gastritis or peptic ulcer, caffeine should be eliminated from your diet. Instead of coffee, try herbal teas, especially chamomile or ginger tea, which soothe inflammation. Also, try to avoid acidic foods and drinks such as tomatoes, citrus juices, and carbonated drinks, which can increase acid production. Following a low-fat diet and eating regular meals can help reduce stomach irritation and reduce the likelihood of symptoms worsening. Given the evidence from medical research, it's important to realize that coffee is not a harmless beverage for everyone, and for certain conditions, drinking it can significantly worsen your health. Number 1. Hypertension and cardiovascular disease. The greatest danger of coffee is for people with heart disease. Hypertension or high blood pressure is a silent killer that can develop without obvious symptoms until something irreversible happens. Drinking coffee when you have high blood pressure is an extremely dangerous habit, and studies tell it straight. According to the American Heart Association, caffeine can cause a sudden but temporary spike in blood pressure. For people suffering from hypertension, such spikes can be catastrophic. Over time, high blood pressure damages arteries, reduces their elasticity, and greatly increases the risk of serious cardiovascular complications such as stroke and heart attack. Caffeine's constant exposure to blood vessels increases the strain on the heart, which can lead to chronic heart failure and arrhythmias. The National Institutes of Health conducted a study that found that people who regularly drink coffee with already elevated blood pressure have a 30% increased risk of developing a stroke. Scientists explain that this is because caffeine activates the sympathetic nervous system, which increases heart rate and raises blood pressure. An example of a tragic outcome can be seen in the story of Mark Jenkins, a 49-year-old businessman from London who drank about 5 cups of coffee daily despite being diagnosed with hypertension. He ignored doctors' warnings for a long time, and one morning, after drinking his usual cup of strong espresso, felt a severe chest pain. It turned out to be a heart attack, which unfortunately ended up being fatal. His doctors noted that coffee, combined with high blood pressure, brought this tragic moment much closer. If you have high blood pressure, reduce your caffeine intake or avoid coffee altogether. You may consider decaffeinated coffee or herbal teas as a substitute. Monitor your blood pressure regularly and listen to your body. If you experience palpitations or other alarming symptoms after coffee, it's time to rethink your habits. This 10-point list summarizes key health conditions in which coffee can worsen, putting you at risk of serious chronic and potentially fatal diseases. In this video, we use data from several major U.S. organizations that play a key role in studying the biological processes of aging, finding ways to slow aging, and developing innovative technologies to extend life. Read more about them in the description below the video. What do you think about this? Do you agree with these statements? If there are any questions, ask them in the comments. More information on this topic can be found at the links in the description below this video and on our channel.
Subscribe and hit the bell for all notifications. Please like and share this video with your friends. Thanks to our sponsors for their support. I eagerly await your comments and encourage you to watch these useful videos.